Welcome to the Expert Roundtable podcast, where we connect frontline clinicians with top thought leaders to facilitate discussion on key issues they face daily.
Hello, I'm today's host, Dr. Lauren Wynand, and welcome to the Expert Roundtable podcast, where we connect frontline clinicians with leaders in their field to facilitate discussion on key issues they face daily. These experts provide their opinions, insights, and commentary on the leading topics and issues in medicine, focusing on specific disease states. Today's topic will focus on atopic dermatitis with Dr. Zelma Chiesa from the University of Pennsylvania, Dr. Sean Quatra from the University of Maryland School of Medicine, and Dr. Leo from Northwestern University and Medical Dermatology Associates of Chicago. Dr. Leo, would you like to introduce yourself?
Absolutely. First, thanks so much for having us. I'm Peter Leo. I'm a clinical assistant professor of dermatology and pediatrics at Northwestern University, Feinberg School of Medicine, and I am mostly focused on atopic dermatitis and other itchy conditions for about the last decade or so.
Wonderful. Thank you, Dr. Leo. Dr. Quatra, would you like to introduce yourself?
Sure. I'm a dermatologist in Maryland, and I love treating anything itchy. So lots of eczema, and all other types of itch. And I work with my colleagues a lot, so really excited that we're going to be able to share some of our work and our different insights.
Fantastic. Thank you, Dr. Quatra. And Dr. Chiesa, would you like to introduce yourself?
Yes, of course. Thank you, Lauren. And hi, Peter. Hi, Sean. It's great to be here with you guys. I'm really excited about this podcast. So I'm an assistant professor of dermatology at the University of Pennsylvania. And following Sean's lead, I am very also interested in the treatment of rashy, itchy skin conditions. So my practice is focused primarily on adults with atopic dermatitis. And I also run the clinical trials for atopic dermatitis within our institution. So very happy to be here.
Excellent. Thank you, Dr. Chiesa. Our first topic for today is dietary interventions in pediatric patients with atopic dermatitis. And I have a couple of questions for the panel on this topic. We'll start with you, Dr. Chiesa. First, do dietary interventions play a role in your treatment of pediatric atopic dermatitis? Why or why not? And if so, are there particular food groups, supplements, and/or guidelines that you consider?
I think this is a very complex question to answer, right? And there are a lot of nuances to it. I think, when you think about atopic dermatitis, we know that there is an association with other atopic diseases, such as, for example, food allergies, right? And this is a very common concern, particularly when I'm seeing patients in clinic. A patient comes in, they're asking, is there something that's triggering my atopic dermatitis? I think it's something that I'm eating. And I would say, particularly in my space, where I tend to see mostly adults, the likelihood that that is the case is actually very, very low. We know that as people get older, the prevalence of food allergies actually tends to go down. However, that doesn't mean that it's not important for our patients with atopic dermatitis, right? I think we need to listen to our patients, particularly our pediatric population and their caregivers. I do think that there is certain patients where their atopic dermatitis may be exacerbated by something that they're eating. Sometimes it's very difficult to pinpoint exactly what that is. And I think the main concern as a physician is making sure that my patients are not going on, very broad elimination diets where they're basically restricting everything that they're taking in order to try to figure out what exactly is triggering this. We hear a lot about peanut allergies and dairy, among other things. And sometimes it does play a role, but oftentimes it doesn't. And I think we have to be careful when we're talking about patients with regards to this. If I do suspect that there might be a potential food allergen that's triggering their atopic eczema, I try to collaborate very closely with my colleagues in allergy and immunology to try to pinpoint exactly what we're dealing here with. And sometimes, there are patients where when you eliminate certain things, their atopic dermatitis does get better. But I think if you look at the literature very closely, we still don't know exactly if that rule applies to every patient, right? And I think we need more studies to better understand that association. I think that there are plenty of patients who have atopic dermatitis who have no known food allergies, and their atopic dermatitis is still very severe and very difficult to control. And they try to eliminate a lot of different things, and their atopic dermatitis doesn't get better. So it kind of makes you think a little bit, well, maybe here it's not so much of an issue. right? I don't know what my colleagues think about this, if they agree or if they don't agree, but that's usually where I stand, right, when I'm counseling patients.
Yeah, no, I totally agree with Zelma's analysis, and I take a very similar approach. And I can really think about this. Parents coming in, could it be the strawberries? Do we need to eliminate gluten? I mean, it's just nonstop. But to echo those comments, for most kids with eczema, food absolutely is not the villain. It's not the dairy's fault. Gluten didn't plot it. Atopic dermatitis, which we'll get into, is very complex. There's skin barrier issues, there's immune dysfunction, there's even microbiome subplots. So the advice is cutting out entire food groups can do more harm than good. And so I think for me, it's all about the precision. And even with history taking, it's about clear precision. In terms of the history, are there rashes, hives, vomiting every time you're being exposed to a certain food group? Sure, then that makes sense. But the science right now doesn't support routine testing or restriction. And actually, sometimes I caution because many patients and their parents already have gone to the allergist or are going to the allergist just to be very thorough. But if you over restrict early, you actually can increase the risk of food allergy down the road. So that's the other aspect of this. I'm also intrigued by the supplements, so the decent data that's emerging, vitamin D, probiotics, symbiotics, all of these different things, but it's early on, but that is very promising. But just, I think, high level summary. So food isn't the enemy. Don't test. Absolutely do not test unless you have a clear cut history. And don't restrict anything unless you absolutely have to. And yes, some of these supplements might help a lot, but I think that's my high level. I totally agree. This is actually a frequent misstep that can cause a lot of morbidity. We don't talk about it a lot, but I've seen it many times where you have that inappropriate, referral to the allergist, elimination, and you get an allergy. So we can really intervene and prevent some of these bad things from happening.
Yes, I'm totally in alignment with my brilliant colleagues here. I think that's spot on. The hard part too is that people often will put a whole bunch of different stock in definitions to what we're talking about when they talk about a food reaction. Everything from hives, which would really be suggestive of a true food allergy, or angioedema, anaphylaxis. That's one category. But sometimes people say they just didn't feel well afterwards, or they felt bloated or gassy, which could probably be something quite different and generally is not indicative of an allergy. All the way through some of the more complex and I think less easy to pin down concepts of inflammatory diets. So I think that's a real thing. Many processed foods, high glycemic index foods, dairy for a lot of people can be pro-inflammatory, but that's very different than being a primary driver of disease. That's very different than being a true food allergy. So we have to kind of take a minute to make sure we're understanding what the patients are saying. And I think we heard that outside of hives, angioedema, anaphylaxis, diarrhea, bloody diarrhea, then it really does suggest that this is probably not really related directly to the foods. And we really understand, particularly for the work of Anne-Marie Singh up in Wisconsin, that exactly right. If we exclude these foods from the diet, even in good faith, just trying to see if they're going to make a difference, we can then potentially sensitize people so that they become actually allergic to those foods. And the mnemonic that I learned from Dr. Ruchi Gupta. She says, through the skin, allergies begin. Through the diet, allergies stay quiet. So if we stop them in the diet, we may lose the ability to protect against that. We lose that tolerance to the food.
I think the one comment, and this is following Dr. Peter and Leo's comment about, anti-inflammatory diets and things of that nature, which I think, there is emerging data. I do counsel my patients, even though I don't think that a particular food is triggering their atopic dermatitis, I do talk about, the importance of a healthy diet overall, right? Where we try to kind of reduce the amount of processed foods that we're eating, not because it's necessarily going to affect the severity of your atopic dermatitis, because overall that's important for good health, right? So it's me trying to kind of take that approach of being the primary care provider for this patient and saying, hey, now that we're talking about this, let me add my 2 cents here and why it's important to maybe not drink, so many sodas, or trying to eat more, healthy, like leafy green vegetables, lean meats. That's the only thing that I really kind of talk about patients that way. It's more for overall health. And it could improve a little bit, but we don't really know. But that's just my 2 cents following Dr. Leo's comment there.
Thanks so much, Dr. Chiesa, Dr. Leo, and Dr. Quattro for sharing your expert insights with us on these important topics for the treatment of atopic dermatitis. And thanks to our audience for tuning in. We hope you found this podcast to be valuable for your practice, and we look forward to having you join us next time.